The results are in. We get this question a lot. If I'm over 65, can I continue my menopausal hormone therapy? The answer is a resounding yes. So, the Journal of the Menopause Society just this month published a study on the use of menopausal therapy beyond the age of 65. They studied 10 million women, Medicare women from 2007 to 2020. Now, what did they find? Let's dig it out a little bit. And the summary answer is really good news. They looked at estrogen only and they found a reduction in mortality, breast cancer, lung cancer, colorectal cancer, a whole bunch of cardiovascular things like congestive heart failure, blood clots, atrial fibrillation, and heart attack, all reduced, and dementia reduced. And that was in the estrogen only arm. So if you have a uterus and you have to take a progestogen, what does that mean? Well, if you're on estrogen and progestogen, so combination therapy, there was a reduction in endometrial cancer, ovarian cancer, ischemic heart disease, congestive heart failure, and blood clots. So that was in the estrogen and progestin group. In the estrogen and progesterone group, because there's different types of progestogens that we can take, and we can talk about that. There was a reduction in congestive heart failure in that estrogen and progesterone group. And we know that with estrogen and progestogen, so together, there was an increased risk of breast cancer. And that risk was about a 10 to 19% increased risk, but it was less with lower doses of transdermal estrogen administered through the skin in a patch or gel. And there was a lower risk with women who were using vaginal estrogen. So, what do we know in summary? We know that the overall use of menopausal hormone therapy over the age of 65 is not just safe, but it actually has a whole pile of benefits in this study. We also know that the route that you take your estrogen, the type of estrogen and progesterone or progestogen that you take, and the length of time that you take it and the dose that you take all matter. So these are things you can have conversations with your healthcare provider about. But we know that the answer to whether you can take your menopausal hormone therapy over the age of 65 is a resounding yes. This is all really good news.